Colleagues from the media, good afternoon, and thank you very much for participating in the 6th press briefing from the Palace of the President in Jakarta. If you recall, in my previous briefings, I mentioned innovative cooperation, innovation and effort to strengthen resilience of the health industries in Indonesia. And today, Minister Bambang Brojonegoro, the Minister of Research and Technology, is with us to speak more on this issue. And last week, in the cabinet meeting, Minister Brojonegoro reported to the President, among others, on the progress of the production of ventilators. Today, Minister Brojonegoro just held a virtual launch of research, technology and innovation products, all made in Indonesia, to help mitigate COVID-19. And of course, Professor Wiku Adhisasmita is also with us to brief you on a number of information regarding the progress of the management of COVID-19 in Indonesia. Colleagues, let me start by updating you on returning Indonesian citizens to Indonesia. In total, as per yesterday, 19 May, more than 99,000 Indonesians has returned home. To be more exact, the number is 99,543. This is an increase of 4,441 within a week. The majority of them are those coming from Malaysia and Indonesian crew working in cruise ships. Between 18 March until 19 May 2020, so more than 2 months, 76,770 Indonesians have returned from Malaysia, and this is an increase of 1,926 compared to last week. Meanwhile, 16,974 Indonesian crews have returned so far from 23 countries, arriving in Indonesia, and this is an increase of 1,154 compared to last year. And on top of that, 5,790 Indonesians have returned home via self-repatriation from 29 countries. This is an increase of 1,325 compared to last week. This number includes 182 Indonesians who returned to Jakarta from Pakistan yesterday. Colleagues from the media, the second issue that I would like to share is the result of the 73rd World Health Assembly, or WHA 73, that took place in Geneva on 18-19 May. For Indonesia, WHA 73 has a strategic importance amidst the COVID-19 pandemic. The convening of WHA 73 has demonstrated the global commitment to strengthen unity and solidarity to fight against COVID-19, and equally important, to better prepare for future pandemics and strengthen global health governance. Therefore, since the very beginning of the preparation of the meeting, Indonesia has been very consistent to encourage all members on the importance of cooperation among countries, to set aside differences and not to politicize the meeting as well as its issues. Therefore, Indonesia decided to co-sponsor the draft resolution on COVID-19 response. This draft resolution was adopted yesterday and co-sponsored by 135 countries. The reason why Indonesia co-sponsored the resolution, among others, based on 6 considerations. First, the resolution underlines the importance to strengthen global cooperation and collaboration to mitigate COVID-19. Second, it prioritizes the universal, timely, and equitable access to affordable health technologies and products through ensuring provision of equitable access to affordable vaccine and medicine, as well as the use of flexibility within TRIPS agreement. Indonesia consistently underlined the importance of this point in the negotiation. Together with other developing and least developed countries, we work hard to ensure our input were taken on board in the resolution. The third consideration, the resolution emphasizes the importance to ensure timely and adequate development and humanitarian assistance to low and middle income countries. Fourth, it promotes the sharing of related knowledge, lesson learned, experiences, best practices, data, materials, and commodities to fight COVID-19. The fifth consideration, the resolution commits to strengthen women participation in decision-making process of COVID-19 response and recovery. And lastly, it acknowledges the leadership role of the WHO in addressing the pandemic. In the meeting, Indonesia also conveyed Indonesia's solidarity on global effort to increase concerted measures to prevent, detect, and respond to COVID-19 through a whole government and whole society approach. In challenging times like this, multilateralism must be the platform for international cooperation in the fight against COVID-19. Therefore, as a member of WHO Executive Board for the period of 2018 until 2021, it is our interest, Indonesia interest and priority to continue strengthening the work of the WHO through our contribution in the formulation of policies and decisions of WHO. Colleagues from the media, my third and last issue is on the chairmanship of Indonesia on the Foreign Policy and Global Health Initiative, or we call it FPGH. On the sidelines of the WHA 73 and as chairman of the FPGH, Indonesia also led a side event meeting to further discuss the issue of affordable health care for all, and this is the theme of Indonesia chairmanship in FPGH in 2020. The meeting also discussed the preparation of the upcoming FPGH Ministerial Retreat that will be held virtually on the 1st and 2nd June 2020. And for your information, who is the member of the FPGH? There are Indonesia, South Africa, Brazil, Norway, France, Senegal, and Thailand. And as an outcome, the meeting of FPGH adopted a joint statement of Minister of Health on concrete collaboration to address COVID-19, including to increase investment and cooperation in research and development for medicine, vaccine, and other health technologies. Another quick update, Indonesia will also participate on the 147th session of WHO Executive Board meeting on the 22nd May 2020. The next governing meeting of the WHO will focus on COVID-19 issues and the urgent decision-making endorsement. And going forward, the government of Indonesia is committed to work closely with all relevant partners to deepen mutual trust, optimize existing cooperation, and develop new platforms of cooperation, especially through joint production of health products to tackle the COVID-19 challenges together. So colleagues from the media, that is all from me. And now I would like to invite Minister Bambang Brojonegoro to convey some updates on technological innovation to fight COVID-19, and then after that will be followed by Professor Wiku. So now it's time for me to give the floor to Minister Bambang Brojonegoro.
Very good afternoon, everybody. Distinguished journalists, ladies and gentlemen. First of all, I would like to thank Foreign Minister Ibu Retno Marsudi for inviting me for this press conference. And I think this press conference is very timely since today is a very important day for Indonesia. It's called National Awakening Day. And of course, in this very important day, we are happy to just announce the innovation product related to COVID-19, and we call this is the awakening of our innovation process. So, when COVID-19 started in Indonesia in early March, the Ministry of Research and Technology initiated the research consortium related to COVID-19, with the members comprising of universities, research institutes, as well as private sectors, state-owned enterprise, and also hospitals. And with that kind of consortium, we already have the program to cover basically all aspects of COVID-19, starting with prevention, and then screening and diagnosis, medical devices, therapies and medicine, as well as development of other supporting devices. So today, in the launching of this innovative product, we can share happily with you that in terms of screening and diagnosis, Indonesia has already innovated our very first rapid test for COVID-19. This rapid test based on IgG-IgM and initiated by the consortium of research institutions like BPPT and also universities like Gajah Mada Universities and Erlangga Universities. So far, this rapid test has been tested in several hospitals in Central Java, and starting either end of this month or early next month, we are going to have first mass product of this rapid test. Of course, this rapid test will keep being improved to improve both the sensitivity and the accuracy. And the development of this rapid test will be using the local transmission virus, the virus that has been spread all over Indonesia. On the other part of the screening, Indonesia already produced also our very first innovation of PCR test kit. So far, both for rapid test and PCR test kit, we depend 100% on import. But with this innovation, PCR test kit, initiated by BPPT, PT Bio Farma, which is state-owned enterprise, as well as a startup, now we have our own PCR test kit that can be used to help doing the so-called massive tests for COVID-19. And similar to rapid tests, next month we will have our very first massive production of the PCR test kit, around 40 to 50,000 units, and of course it can be used immediately by labs all around Indonesia. So those related to the screening and diagnosis. And I would like to ensure to you that we will keep improving both sensitivity and specificity of this test kit. So to improve accuracy and of course to make the Indonesian innovation at the par, at the level with rapid tests or PCR tests from other countries. On the medical devices, we would like to report to you that we already have currently 8 ventilators already passing the test by Ministry of Health. 5 of them actually have finished all type of tests, both the equipment test itself as well as the critical test. So for those 5 ventilators, we can tell you that these ventilators can cover both ventilators for the ICU, intensive care unit, which is invasive, and then also ventilators for emergency room for the ambulance, for the transport, as well as ventilators for the portable one to help people with the breathing difficulty. So this is very first ventilators produced in Indonesia, and we will start massive production also by next month, with the estimation that one factory can produce up to 200 to 300 ventilators units per week. So we hope that the shortage of our ventilators that already happened since couple of months can be readily fulfilled by these domestic produced ventilators. So that's related to the medical devices. And please note that this kind of innovation just started about 2.5 months ago. So very short period of time, Indonesian researchers, Indonesian innovators finally can design their own ventilators as well as test kits. On the other issues, for example, medicine and therapies, on the medicine, we will keep doing the research on medicine with the focus now on immunomodulator. Basically, in Indonesia, it's called supplement, to improve our immunity against COVID-19. So we are now trying some Indonesian herbal products that will fit with the ideas to defend against COVID-19. Different type of herbals have been tested. Of course, we did some clinical trial in order to make sure this herbal medicine will fit with the idea of defending against COVID-19. And then the other part that is also important is the therapy. Yes, we do not have the medicine for COVID-19 all around the world, but we also need to start with the therapy. So for the therapy, our focus now on plasma convalescent. In this therapy, basically we got the plasma from the survivor of the COVID-19 that has some immunity in the plasma, and then this plasma will be injected to the current patient of COVID-19, and we hope it will improve their condition. So far, the research has started in several hospitals, and it will be enlarged to more hospitals. And so far, the result is quite relieving. But of course, we still need to know more and more results from different hospitals and more patients. And then, related to the therapy, we also start looking for the stem cell. I think one of you asking about the stem cell. So, the University of Indonesia already proposed mycelial stem cell that will improve the lung condition that has been attacked by the COVID-19. So we hope this mycelial stem cell could also be another part of therapy to help patients with COVID-19. Last but not least, of course, you will ask about vaccine. In Indonesia, led by Eijkman Institute, Indonesia already submitted currently 9 whole genome sequencing. This whole genome sequencing or gene analysis is a very important part to develop the vaccine, because first we have to know the character of the virus that now spread in Indonesia. From those 9 whole genome sequencing, 7 submitted by Eijkman Institute and 2 others submitted by Erlangga University in Surabaya. The results so far, if we know that in GISAID, the so-called the big data bank of the influenza, there are 3 types of COVID-19. Type S, type G, and type V. And then another one is called others. So far, from the 9 sequencing that we have submitted, 8 categorized as others, meaning other than S, G, or V. 1 related to G. So this is of course very temporary result, and we still wait for more genome sequencing submitted by the Indonesian institution. Eijkman Institute itself plans to submit 100 genome sequencing. And then for the vaccine development itself, currently Eijkman Institute is progressing on making protein recombinant as a part of developing the vaccine. But of course, we do not know when the vaccine can be fully developed and can be used for defending the people against COVID-19. And of course, for the supporting devices, we already developed also mobile BSL2 lab, so mobile lab with the safety level, biosafety level 2. So this mobile lab can be used all over Indonesia, movable of course, and of course it will help in doing more PCR tests, swab tests, as well as doing other tests like rapid tests or blood tests. So I think in general, this is what we have done so far related to the medical equipment, medicine, vaccine, as well as supporting devices. And of course, we're still working very hard and we keep improving. So we hope that with the COVID-19, all Indonesian researchers will be able to reduce our dependence to import. So far, I can share with you, for medical equipment, Indonesia depends 90% to the imported product. And for the medicine, we depend around 90 to 95%, so even higher. So this is the time for Indonesia to innovate, and this is the time for Indonesia to reduce the import dependence to big producer or to other countries. Thank you very much.
So thank you very much, Minister Brojonegoro, and Professor Wiku will join us during the Q&A session. So colleagues from the media, now we move on the Q&A session. We have received questions from 9 media: Morocco Press Agency, ABC, Voice of America, China Central TV, Channel News Asia, Sky News, New York Times, Kyodo News, Taiwan Central News Agency, and NHK. Of course, Minister Brojonegoro will answer the question related to research and technology, while Professor Wiku will update you on technical data and details. And as for me, I would like to start with addressing some questions from you. My first response is for the question from Moroccan Press Agency on the latest development on international cooperation for COVID-19 mitigation. To date, Indonesia has collaborated with 111 international partners, comprising 11 countries, 12 international organizations, and 88 NGOs. On the question from Voice of America, that is regarding the vaccine, I think I don't have to repeat it again, since Minister Brojonegoro has mentioned about the development of vaccine in Indonesia. And I just want to add here that the position of Indonesia is very clear that the vaccine must be accessible and affordable in timely manner for all countries, especially for developing and least developed countries. And then Indonesia is one of the co-sponsors of the resolution of WHA 73. I mentioned it to you. And then the UK, France is among those who co-sponsor also the resolution. So I think it's very clear. Now move on the question from China Central TV, CCTV, on the trade volume growth between Indonesia and China. Colleagues, China is one of our important trading partners. From time to time, we try to diversify our trade with China and to narrow the deficit gap in our bilateral trade. Between 2018 until 2019, so that is pre-COVID period, there were significant increase of Indonesian export product, especially agriculture and fishery products. For example, palm oil has seen an increase of 24.14%, and then packaged fruit has seen an increase of 1,132.44%. Canned fish, there is an increase of 134.23%, while on the mangosteen export, in the first quarter of 2020 alone, we have seen an increase of 111%. And then answering the question from Voice of America on the development of cooperation between Indonesia and the United States of America in terms of ventilators, what I would like to share with you is that Indonesia and the US have been in a close communication regarding cooperation on ventilators. On May 4th of May, USAID in Jakarta has communicated with the Ministry of Health to identify the specification and other technical matters related to the ventilators. And then on the 5th of May, the said information, the information that requested by USAID to the Ministry of Health have been submitted back to the USAID. While in the Indonesian Embassy in Washington, D.C. has also touched base with the U.S. Department of State, DOS, and the National Security Council on this issue as well. And we were informed that the delivery could take place by end of May or early June. And you also listen from Minister Brojonegoro that in the meantime, Indonesia is also preparing to have or to develop Indonesian-made ventilators. And then with regard to the question from Kyodo News on when ASEAN Ministerial Meeting, ASEAN Regional Forum and Post-Ministerial Conference take place, as of now, the 53rd SIMM, the ARF and the PMC are still scheduled to take place in Hanoi on the 31st July until 5th August 2020. But of course, everything will depend on how the situation of COVID-19 will be at that time. However, we know that there are many ways to make the meetings happen through virtual meetings, for example. Next question is from Kyodo News and ABC about the Indonesian stance in regard to the boat people from Rakhine State that were sighted near Aceh, and also will Bali process organize talk on the matter. Allow me to answer in one go. First, to clarify, there has not been any refugee movement sighted, closing, or entering Indonesia water. This was also confirmed by Pol Air Ud, or Indonesian Water and Air Police Unit of the province of Aceh, after conducting air patrol along the northern coastline of Sumatra Island last week. The Rakhine State issue, has been Indonesia's as well as ASEAN concern since the very beginning, with its humanitarian dimension and also implication toward regional peace, stability, and security. With the current context of COVID-19, this issue becomes more complex as it may pose greater humanitarian challenges. To address the situation, Indonesia will utilize all existing avenues to address this issue, including through the Bali process, where Indonesia is co-chair with Australia. To this end, Minister Payne of Australia and I have talked last Friday regarding this matter, including to address the issue in a comprehensive way from the country of origin, transit country, as well as countries of destination, taking into account the challenges brought by COVID-19. Refugees from Rakhine State are indeed vulnerable from being trafficked and smuggled. They are victims of trafficking in person. So the international community also has the responsibility to protect them as victims of people smuggling and trafficking in person. Next question is from Moroccan news agency on why Indonesia supported the Australian investigation into the origin of COVID-19. I have to underline this. Look at the resolution of WHA 73 on COVID-19 response. I explained it to you on my presentation. In the resolution, there is no single mentioning about investigation. What is clear, there will be a comprehensive evaluation to review experience gained and lesson learned from WHO coordinated international health response to COVID-19, as well as in the strengthening of global health governance going forward, which supported by WHO. This resolution was co-sponsored, I mentioned it to you before, by 135 countries, including Brazil, Russia, Japan, the Republic of Korea, Australia, and China, and it was also welcomed by DG of WHO. Also from Moroccan news agency on the question whether Indonesia envisaged cooperation with Morocco as well as fellow member of Ministerial Coordination Group on COVID-19 for action dedicated to African continent facing COVID-19, the answer is yes, for sure yes. Indonesia and Morocco are committed to work together, among others through the ICG as well as any other international forum to address COVID-19, including for the region of Africa. We cannot address COVID-19 entirely if we leave anyone behind. No single country or continent should be left behind, including countries in Africa. In regard to the question by Kyodo News on the progress negotiation of the Code of Conduct on the South China Sea and whether China using COVID-19 pandemic to delay the negotiation, I think I had explained this issue in my briefing on the 6th May 2020, and the status of the issue remains the same. On the question from Kyodo News on when Indonesia will reopen travel restriction for foreigners to Indonesia, I have addressed this also many times, but let me re-emphasize that it will depend on the development of this situation. The policies are temporary in nature and will be further evaluated in due course. Next, I wish to respond to Kyodo News whether Indonesia and 14 other countries will let India go in RCEP negotiation. As stated by the leaders at the third RCEP summit, 15 RCEP participating countries have concluded text-based negotiation for all 20 chapters, that is including all market access issues. Currently, the legal scrubbing process is almost completed by the 15 RPCs for the preparation of signing in the late 2020. At the same time, 15 RCEP participating countries or RPCs have continuously engaged India and are still trying to resolve the outstanding issues with India, with a hope to achieve a mutually beneficial outcome. An RCEP agreement that is modern, comprehensive, high quality, and mutually beneficial would be of significant importance, especially to enable a swift and resilient global economic recovery post-COVID-19. And then, responding to the ABC question on how many Indonesian crews are infected and how many are still in cruise ship. As per yesterday, 19 May, there were 5 crews who have died, 68 crews are positive, and 100 crews have recovered. And the last question is from Morocco News Agency again on the latest report on COVID-19 related to foreign community in Indonesia. As per today, 20th of May, out of 626 cases, 22 foreign nationals have died, 201 have recovered, 94 are positive or under treatment, and 199 are under monitoring or observed. In Indonesia, we call it ODP. And 3 are unconfirmed. Now, I have answered all the questions directed to me, and now I give the floor to Minister Projo Negoro, and after that, I will invite also Professor Wiku to respond your question. Thank you very much, colleague.
Let me start response the question from Taiwan Central News Agency about the update on vaccine and treatment, including herbal medicine. I mentioned already in my brief remark that on vaccine, we are still working on the research of vaccine, and the latest progress is on making the so-called protein recombinant that will be part of the vaccine development itself. And then for treatment, we are now focusing on plasma convalescent, and also we start with this stem cell therapy, mycin stem cell therapy. And then for herbal medicine, yes, we have variety of herbal medicine. Now we are doing the clinical trial for many types of herbal medicine by doing first the systematic review, bioinformatic research and development, and also at the end the clinical assessment. And after that, we hope we can produce the immunomodulators or supplement, mostly based on local materials. Also from Taiwan Central News Agency, and I think the question is similar from Kyodo News about the progress of ventilators and other medical equipment. As I mentioned earlier, for ventilators, so far we have total 8 types of ventilator already passed the equipment trial by Ministry of Health, but only 1 of them already passed the clinical trial, while 4 of them still completing the clinical trial, and 3 others waiting for the clinical trial. For the one that already finished both equipment trial as well as clinical trial is the one initiated by Bandung Institute of Technology, and now they are in production for the massive production together with state-owned enterprise and also private sector. For this Bandung Institute of Technology ventilator, the type of ventilator is CPAP ventilator, or sometimes it's called portable ventilator. While for others, the one that's still doing the clinical trial, it is for emergency pneumatic-based ventilator, and also for CPAP and CMV. They are now in clinical trial in the Wisma Atlet Hospital, the former dormitory for the 2018 Asian Games, that now becomes the emergency hospital. And then for the test kit, as I mentioned earlier, for rapid test kit, we already in the stage of production for rapid test kit to detect IgG, IgM based on synthesis peptide. And also, we are going to develop rapid tests later based on microchip. And then for PCR test kit, we also have completed our RT-PCR test kit that now being at the production around 40,000 to 50,000 units. So both for rapid test and PCR, we have completed the first stage, but we will keep improving in the next research and innovation process. To answer the question about from Kyodo News, I think from stem cell development, I mentioned already the one that developed by University of Indonesia. At this moment, this process has obtained the ethical license and ready for clinical trial. So hopefully within some time we will have a stem cell that will help for COVID-19. And then from Channel News Asia, the question about vaccine development and related to the type of the virus strain in Indonesia. As I mentioned earlier, we have submitted 9 whole genome sequencing, 7 from Ekman, 2 from Erlangga universities. From those 9, 8 belongs to category others, strain others, while 1 belongs to G. Meaning that for our vaccine development in Indonesia, at least we have to pay attention for this others category, because we have to produce vaccine that will really help the Indonesians. And then for the vaccine development itself, we are open for international cooperation with 2 main principles. The first principle, there has to be co-development or transfer of technology whenever we have cooperation with foreign partners. And then the second one, of course, Indonesia needs to have their own property right for the vaccine itself, because we need to produce vaccine that will suit for Indonesian case. And just to tell everybody, Indonesia really needs to produce vaccine if we are able, if the vaccine is available. Why? Because Indonesia is a big country, 260 million population, and I think it's very risky if we depend only on the production from abroad. So we really need to have both capability of production as well of development. And then for the question also from Channel News Asia about the eucalyptus that recently developed by Ministry of Agriculture. Yes, there were some evidence about the good impact of eucalyptus to few patients of COVID-19. In fact, I already talked to one of the survivors of COVID-19 that has been helped by this eucalyptus medicine or eucalyptus treatment. But of course, to claim that this will be a good immunomodulator or good medicine for COVID-19, we need, clinical trial. We need massive clinical trial to make sure that this is the medicine. So far, Indonesia also trying to use some medicine that has been categorized as successful outside Indonesia, but still, we still do the clinical trial to make sure which medicine or immunomodulator that will fit with Indonesian case. Okay. From Sky News, the question is same about vaccine development, and then for Channel News Asia, the question about I think the medical equipment. I mentioned already ventilators. I mentioned already about the test kit. But I also would like to update about our innovation of mobile lab of testing the PCR of COVID-19. So this is mobile lab with category biosafety lab 2, and this can be used everywhere because this is provable, and we can produce it in relatively short period of time, rather than building, permanent building for the laboratory with the BSL2 or BSL3. We can use the container and then modify into the BSL2 type of lab, and it can be placed anywhere, and it can be used for testing the PCR, testing the rapid test, as well as for the blood test. And then for other products, we have the robots to help dealing with the patient of COVID-19, so to reduce the interaction between between nurse, between doctors with the patients. So it can be substituted to some extent by the robots. And then to help also the medical people, we have developed power air purifying respirator to make sure the oxygen will be clean and clear for all the medical staff. And last but not least, we also produce equipment to basically sterilize or to clean up the area or the building from possibility of COVID-19 using technology of ultraviolet. I think I have answered all the questions directed to me. Thank you very much.
Good afternoon, attendees and international media colleagues. Thank you, Ibu Retno, our Minister of Foreign Affairs, and also my good friend, the Minister of Research and Technology, Pak Bambang Brojonegoro. I'm Wiku Adisasmito, the Chair of the Expert Team of the National Task Force for COVID-19. I'm here to represent Pak Doni Monardo. Again, I would like to also express my appreciation for the national and international media, who is always with us every step and development of COVID-19 mitigation in Indonesia. So moving on the questions from the media. The first question is from Taiwan Central News Agency. Despite the effort being made to increase the testing capacity, the testing backlog seems to remain high. Is there any other way to address this problem? For example, given that the main hurdles lies in the shortage in human resources in laboratories, is it possible to have personnel from other countries where the pandemic has been brought under control come to Indonesia to help? So during the last 2 months, ever since the task force was first established, our priority remains the same: improving the testing capacity evenly nationwide, allocating test kits, human resources, and single source of data integration. We haven't been able to utilize the 10,000 testing capacity consistently, but we have seen some testing improvements, especially in the large cities. We even reached 12,276 tests in one day, which is on May 19th. At that time, we reached 202,936 specimens tested. I would like to inform all of you that the head of the National Institute of Health Research and Development under the Ministry of Health has been appointed as National Laboratory Coordinator. This is a very important step because as of now, there are 128 laboratories. When we started at the beginning of March, we started with 52 laboratories. And among those, right now with 128 laboratories, there are 10 institutions which handle those labs. First, I would like to mention there are 24 Ministry of Health laboratories, which is under the direct coordinations of the NIHRD head. But also, he is responsible now to coordinate 42 local government laboratories. Also 8 private hospital associations labs, 20 laboratories under the Ministry of Education and Culture, 2 labs under the Ministry of Research and Technology, and then 5 laboratories under the Indonesian FDA, 8 laboratories under the Ministry of Agriculture, and 13 laboratories under the Ministry of State-Owned Enterprises, and then 2 laboratories under the police, and then 4 laboratories under the armed forces. You may imagine that this great task is handled by the head of the NIHRD Ministry of Health, and we hope with this responsibility, the coordinations of the national laboratories will be improved soon. For each of the 68 active laboratories that the task force and Ministry of Health direct coordination with, we have also deployed volunteers and extra staffing to help complete form and data collections. We are also in the midst of providing incentives for laboratory assistance. We also encourage partnership as much as possible. From within the country, we collaborated with the WHO, with the Indonesian Institute of Science, also health training, and there are also private hospitals that carry out training for the PCR machine personnel. The second question is from Kyodo News. On some occasions, Pak Doni Monardo repeatedly said that now the capacity of the beds in hospital is higher than the number of the patients being treated for COVID-19. Does it mean that there will be no patients suspected of getting infected with COVID-19 having to go from one hospital to another to find vacant beds? The conditions right now, we are anticipating and being aware there are people who are still mobilizing in the upcoming days. We ensure that the capacity of the hospitals throughout Indonesia is still sufficient to accommodate patients infected with the COVID-19. This week, the total bed occupancy rate used in provinces that are carrying out PSBB, such as Jakarta, 54.3%, while West Java 28.9%, West Sumatra 41.1%, and currently we are able to fulfill the demand of patients' hospitalizations resulting in vacant COVID-19 beds. The third question is from Channel News Asia. Last week I mentioned that there are many models which aim to predict the peak of the COVID-19 in Indonesia, and previously I noted that it could reach 100K. Which model is the government now relying on, and what is the latest estimate of cases during peak? When would the peak now be? So I would like to mention again, as I mentioned earlier, that prediction is only a prediction. Since we are now having much better data management in the National Task Force, we managed to work with real data that is regularly published at the official website and do more analysis. I'm sure you all are able to access our website at the www.covid19.go.id. The modeling and projections we used earlier was to map the capacity of our country to face the disease. With the real data, our focus now is on how to ensure that behavioral changes and health protocols are truly carried out to reach the restoration of safe, productive activity. Questions number 4 is from Morocco News Agency and also from NHK. Can you tell us which area of Indonesia is doing well to contain the spread of COVID-19 and which area needs to monitor more closely to reopen the economic activities? Also, which region in Indonesia has recorded better management of the epidemic and why? First, West Java so far is doing very well based on the epidemiology indicators. West Java is one of the provinces that has a strong commitment against COVID-19 transmission. Based on our data in Bersatu Lawan COVID or BLC, West Java showed a decrease of positive cases after PSBB was implemented. It possibly due to massive rapid test of West Java a couple weeks ago. West Java also performs a good coordination with the central government, which makes West Java potentially could be a local champion in the fight against COVID-19. Of course, we are expecting that other provinces under the PSBB, the other 3 provinces, and the other 27 districts and cities are following the good examples. The 5th questions from Moroccan news agency: how to explain the high daily mortality rate recorded during the last days? We recognize that on the 17th of May, 27 out of 59 fatalities came from South Kalimantan. This is extraordinary, we understand this one. 68% out of the 27 fatalities came from Goa cluster in South Sulawesi. This happens after a mass religious event held from the 19th to the 22nd of March 2020, dubbed Asia's World Ijtima 2020 in Goa, South Sulawesi. 8,000 people coming from all over Indonesia and abroad were foreseen to attend the occasion. Eventually, the agenda was brought to cancellation despite the mass already assembled in the venue. Subsequently, we see surges of positive cases in districts where the attendees originated. This must be a learning point for all of us all over Indonesia. Mass gathering will inevitably be a hotspot for virus transmission, and we fear that mobilization of returning to their residency will subsequently provoke the rise of new hotspots in their hometown. In regards to this, we call on all of the citizens to refrain from practice of e-exodus and so-called as mudik. The 6 questions from the New York Times: under President Jokowi's plan to coexist with the virus, how many additional virus cases and deaths do experts predict will result? The ability that is God's greatest gift to humans is adaptation. So we will coexist with the virus by adapting to the virus. New normal is the output of the adaptation, and the community must prepare for it, as if we are dancing with the wolves. Additional cases and deaths can occur if we are careless when dealing with the virus. For that, we always remind us to change our behavior together by doing 4 healthy, 5 perfect, or 4 sehat, 5 sempurna. The first one being wearing a mask. The second is keep a distance. The third is hand washing. The fourth is regular exercise and adequate rest and no panic. And the 5th is consumption of nutritious food. This motto is very familiar for the Indonesians. That's why now remodified for the COVID-19 era. A call to collective behavior change needs to happen, and for it to happen soon. The 7th question is from Taiwan Central News Agency. The government plans to ease PSBB has led to concern that the government tends to develop herd immunity against COVID-19. Is this an option the government is looking into? I would like to confirm you, the answer is no. Easing PSBB is not connected with the herd immunity. But over time, of course, for those who have high immunity, will develop a certain collective adjustment to the virus. COVID-19 not only became a health problem, but also develop economic, social, and cultural problems. Careful considerations taken from all of these aspects resulted in these decisions to relax the PSBB. The degree criteria also does not immediately free the community to do everything. The community must follow the health protocol consistently in each of its activities so that the number of the new cases does not increase. Our main goal is only one: to suppress the COVID-19 case. The 8th questions from NHK. Can you specify the data which would be taken to considerations to reopen economic activity or ease PSBB? Our response that the National Task Force for the Acceleration of COVID-19 Mitigation has been analyzing a few ways to be taken as indicator to lift PSBB, which by that time comes, we plan to lift in stages. We are presently looking at the World Health Organization's criteria for the health aspect, which comprises 3 indicators domains, namely epidemiology, health system, and public health surveillance. In these 3 domains, we will take into account the curve of COVID-19 cases, our capacity in conducting mass testing and contact tracing, the populist mobility, local and inter-regions, and evaluations toward the capacity of our healthcare facilities and also logistic sufficiency. The 9th question is from the Channel News Asia. What are the strategies being thought of to prevent a possible second wave of infection after the Eid holidays when people are expected to go back to the urban areas? We come to realize that the upcoming Eid al-Fitri will be very challenging. In normal days, Muslims will gather in masses to conduct Eid al-Fitri prayer. Afterwards, they'll usually pay a visit to their neighbors and relatives, also known as silaturahmi. However, for this year's celebration, the government has banned inter-region and local exodus in order to curb the disease. Though we realize that monitoring and evaluation regarding the enactment must be encouraged more vigorously. The government also prohibits Eid al-Fitri prayer in an effort to curb the spread of the disease. Careful religious deliberation have been taken before we come up with such a policy. These are few measures that we impose beside PSBB to minimize mobility. Indonesia is also enacting unprecedented policies at the public transportation, such as airport and harbors. The passengers about to go on board require 3 documents to be validated, for example, at Soekarno-Hatta airports, namely ticket, health certificate stating COVID-19 negative, and statement letter from their office. There are multiple checkpoints and the officer will check their body temperatures before letting them go on board. The success of this policy is, of course, law enforcement. The 10th question is from ABC. Is the second wave inevitable given the massive crowds we have seen at the airports, markets, etc.? To be frank, the massive assembly at several public centers also comes into our concern. We are still vigorously prohibiting the activity of exodus or so-called mudik related to the Eid celebration. In regards to this, the government is coordinating intensely with the Ministry of Transportation. Prompt response is imperative. Several unprecedented policies have been imposed in transportation hubs, as I mentioned earlier. Regarding shopping centers, until today, several markets and shopping centers are open as a way of fulfilling the populace daily necessities. Sectors that are prioritized to be allowed to open are 11 sectors that are related to logistic and basic daily necessities. 11th, the questions from ABC. We have seen a lot of pictures of massive crowd. Is there any concern from the medical sectors? We saw a medic with the sign, Indonesia terserah. What happens if doctors are protesting or strike? Yes, we are aware that such movement has arose recently, and I would like to take it positively. As we see, the action is not only done by the healthcare workers, but also a large number of the Indonesian commoners as well. I see that such bluster actually represent concerns, care, and also inclinations for the people to take part in this pandemic in order for their concerns to be heard. We heard that. And yes, I would like to acknowledge that their voice is heard and important, for such criticism is not only to appeal the government, but also as a call towards all the citizens and other elements to comply with the health protocol obediently. I would like to emphasize that we are not backing down. Indonesia tidak menyerah, and the rise of such a massive movement proved to be so. The last questions, the 12th questions from the New York Times. Many malls and shops are packed with people preparing for Idul Fitri. Some countries are taking steps to reduce the coronavirus spread during this time, such as Turkey, which will impose a 4-day lockdown starting Saturday. Will Indonesia take similar action? Indonesia is currently imposing large-scale social restrictions, PSBB, for 4 provinces as indicated, which the policy comprises several restrictions for people to conduct activities outside. There are only 11 sectors that are permitted to operate during the enactment of the PSBB. Indonesia is still focusing on strengthening the policy, for fluctuations in policy will drive citizens bewildered. Other extra measures that we are taking consist of coordinating with regional and local task force. Indonesia is a very diverse and large-scale country, and we cannot impose one single stringent policy for all regions. Each province might need to adjust of its own citizens. We have been expecting Idul Fitri a few days ahead. A moment not only matters from the religious perspective, but we have to know from the social and cultural perspectives. In this Idul Fitri, maybe this time we cannot unite together in a mosque or our parents' house, but we can unite in our respective places by doing what we can to fight this pandemic. These days, this is an important part, mudik has become an extremely dangerous thought. With the countries battling the spread of the coronavirus, the significant contributions of every single citizen living in this country can make to the effort of squashing the sombrero is by staying at home and limiting contacts with people outside of their homes. So during the COVID-19 pandemic, every citizen is expected to be able to survive and adjust to the new life patterns. Collective discipline and behavior guided by the health protocols are needed when they are active, especially in the public facilities. As also instructed by the President, the key success in controlling the spread of the COVID-19 is discipline. Discipline is abiding the health protocols. Cautiously moving forward with the restorations of safe and productive activity. Thank you very much. I return this to the Ibu Retno. Thank you.
Well, thank you very much. Thank you very much, Pak Bambang. Thank you very much, Pak Wiku. And thank you very much to all of you, colleagues. Colleagues, inshallah, Muslim all over the world will celebrate end of Ramadan very soon. So Idul Fitri, Eid al-Fitr is coming. So let me convey happy Eid al-Fitr, Minal Aidin wal Faizin, mohon maaf lahir dan batin. So stay safe, stay healthy during the Eid al-Fitr celebration, and I'll see you inshallah next week. Thank you very much once again.